COPD is a chronic disease that can impact daily life for 27 million people who have it, putting them at greater risk for COVID-19 as well. Let's welcome Dr. Thomas Cornbridge along with COPD patient Jan, who are here to tell us more. Thank you so much for being with us.
Good morning.
Thank you. Good morning.
So Dr. Cornbridge, I want to start with you. How has COVID-19 impacted COPD patients?
Well, as you said, COVID-19 certainly has impacted our patients with COPD. We know that if you have COPD and you get COVID, you're at increased risk of worse outcomes. So I think it's really been a wake-up call for patients with COPD to do everything that they possibly can to protect themselves. That would include, of course, the usual guidance we've all been given, hand washing, face masks, social distancing, but also to really connect with their healthcare providers and stick with that individualized treatment plan, which can help keep them out of the hospital, particularly for COPD flares or exacerbations.
And tell me more about this recent survey.
So the survey that was just conducted by joint efforts of GSK and the Chest and COPD Foundations showed that there is a gap between the understanding of where our patients are and how our physicians are viewing them. And we've known this gap has been there for a while, but the survey cemented this concern. So patients often may underreport where they truly are. We would absolutely love our patients to catalog where they stand in terms of symptoms in the most honest and open way. Tell us how short of breath they are, what activities have been impacted by their COPD, what they're able to do and can't do, how it's impacted their social lives, their relationships. Not attribute symptoms to other things necessarily, such as, maybe not being as active as possible. Some people think their symptoms are from gaining weight or getting older. So it's a matter of coming to visits with a true cataloging of symptoms and being open and honest. Our physicians, on the other hand, know and need to know that they have to spend time and ask those good probing questions, build that trusting and non-judgmental relationship. And this way we can narrow the gap that this survey showed us between where patients are and how physicians understand where they are.
Jan, has COVID-19 impacted the way that you manage your COPD?
Like so many of us with COPD, COVID has impacted my life significantly and the management of my disease. And according to the survey, not only just me, there's 63% people that said that COVID has had a negative effect on them. With that being said, it has scared us half to death. We're all afraid. We were afraid to go out of the homes. We were afraid to have anyone in the homes. So we had to figure out ways. There was a wake-up call for us with this COVID. We had to figure out ways to get around the stereotype, and because we didn't know a lot about the disease, but we had to figure out how to manage the disease and to keep up with our daily routine. And that was getting in touch with the clinicians and talking with our doctors and support groups or whatever we could do to help us manage this disease as best we could with something that had come upon us that none of us understood. Even the medical community did not understand. So that's the biggest impact, was the unknown and getting a grip on how to manage everything.
And what advice do you have for improving communication with doctors or caregivers?
Oh, as far as my thing with everybody, COPDers, communication, getting connected with your doctor, sitting down with your doctor, showing your vulnerabilities, letting them know what it is you need, what you want from them, what you should do, what are my best medications, what are the best whatever. Give me all you got. You got to go in and just let the vulnerability flow. And just let you and your doctor, you got to have that fit. Okay, and you got to come up with an action plan. What am I supposed to do if this happens? Okay, when do I have to worry about whether or not I have COVID? The best thing to do is to empower yourself. And you empower yourself by knowledge. Knowledge is power.
And doctor, where can we go for more information?
Well, and I just second what Jan said. Knowledge is power, and there's a lot of knowledge out there to be had, particularly from your healthcare provider, which can give you that individual spin on COPD information. But there are websites that have a wealth of information. I would certainly recommend COPD.com to patients, caregivers, and listeners who have interest in COPD.
All right. Thank you both so much for being with us. Really appreciate it. And we will be right back with more Midday Maryland right after this. Stay tuned.